Well, it's very, given COVID-19 and what is expected to be very, very difficult going forward. I mean, these pandemics are not over. They will continue. But China has really been thinking very forward about this. They've been planning special economic zones for medical tourism since 2013. One of them will be completed by 2025, and this is going to have a huge impact as they seek to reverse this kind of outward bound medical tourism.
Well, talk to us about how the coronavirus pandemic impacted healthcare in China in the last year and a half. Some of it we saw a lot of, but just talk to us about some of the pivots that you've seen, the challenges and the successes.
Well, I mean, the challenges have been, while these they were able to control it in most areas, there was that brief period there, in that 3-month period, when everything was locked down. There were health care workers who were at risk. Obviously, PPE, preparedness, emergency planning, these are all absolutely essential to the process that China knows which will happen again. So it's just a question right now in terms of how you manage all of this. There's greater expectations, a larger middle class. They want to have more medical options. And this is what you've seen, with the elimination of, extreme poverty. Part of that is having access to medical care. And there's been a tremendous amount of effort to make sure, obviously, when you have a pandemic, you have to reach every part of the country. It's not a situation where you can just concentrate on the wealthy or urban areas. So very important, they continue to expand.
And we are seeing that in the story in Guangzhou. What kind of efforts are underway to improve China's healthcare system? What do you think will have the biggest impact when it comes to some of these improvements? Just based on what you've experienced, is it the care? Is it the processes? Is it the logistics of serving so many people?
Well, it's logistics is obviously with 1.4 billion people, a very large landmass. You have to be able to have localized clinics. But what you're seeing is technology is eating into this area. It's providing solutions, remote doctors, et cetera, which are allowing them to provide more cost-effective, efficient medical services to many people. If they can be diagnosed and if there's a problem, they can be sent to a care clinic rather than clogging up clinics because people, they're not certain or they're worried or something like that. There's also now a more increased drive towards traditional Chinese medicine. Now, this is not the kind of stuff that you see in the United States where somebody with a 2-year degree who may or may not have finished college has gotten. This is a practice in China where you have to go through a full 4 years of medical school, and then on top of that, you have to specialize for another 4 to 5 years just to learn the basics of traditional Chinese medicine. So they have a tremendous store of information, knowledge. They want to share that with the world. It's very cost-effective, and it has been proven very therapeutic.
Well, that being said, Einar, that is taking up a very important space during this 4-day forum, and we really haven't heard much about it, as you mentioned, about how it's helped during the pandemic. Can you talk to us a little bit about how it has helped or been used, help people get through COVID-19 there?
Yes, traditional Chinese medicine it's not like a vaccine. What it does is it tries to concentrate on the underlying root causes of people's conditions. For instance, if you have low immune system, what traditional Chinese medicine can do and is very good at, and it's been proven, is they can boost that. Through, and it's not magic. They do use some herbs and things like that, but a lot of it is based on exercise, some massage. They have a theory about the energy in the body and how that has to be kept in balance. Like I said, this is thousands of years old. It's proven very effective for the Chinese people, and there are many adherents around the world. So this is not a miracle cure. This is simply another piece of the puzzle which can help people survive these very dangerous times.